Good morning, everyone. We want to thank you for being here for today's webinar. So we're excited to welcome back Dr. Lynn Silver from the Public Health Institute, the Prevention Policy Group. So today's session is titled Cannabis in Youth, What Are the Effects on Your Health? So lots of great information that we're going to hop in to momentarily. And then also just want to highlight that there is a coaching opportunity. So if you hear today's content, you want to learn more, you want to learn more about how to use this information and apply it to your policy systems and environmental change initiatives. And we certainly encourage you to sign up for a time to connect with Dr. Lynn Silver and others from her team. So again, thank you, and I'll go ahead and pass it over to you now.
Thank you, Shara. It's a pleasure to be here with all of you today. Today I'm going to talk about cannabis health effects and some broader effects on youth. What exactly are we seeing with the data on cannabis? Some of it's my research, some of it's other people's. Um, and I'm going to be a little more informal today. So if I'm talking about an issue and you have a personal experience with the kids that you're working with or your own life or others, it's okay to chime in through the chat or raise your hand and share it with people. And I'll be including some observations of what clinicians are seeing too. I'm a pediatrician, although I mostly work in public health practice now. Um, so, okay. Disclaimer, I'm not going to read that. These represent my opinions and not those of the Department of Healthcare Services. I'll read that part. So we're going to start with just a little bit of an icebreaker. Why should we care? Does cannabis have beneficial effects? How did legalization affect youth? What are the adverse effects of cannabis on health? And what are some strategies to reduce adverse health effects on youth? And then I'll just reiterate some tools and resources that may be available and that you may find helpful in your work. Um, so first, why should we care about cannabis policy? There's so many important issues in the world right now: immigration, housing, um, issues that are really urgent. And this is one more issue that we need to care about. And let me talk a little bit about it. First of all, let me raise your hand if you know somebody who feels like they've benefited from cannabis. Oh, actually, from cannabis use. So I see a few people raising their hands, 7 of 79, 10, probably more. But there are quite a number of people out there today who feel or say like they're benefiting from cannabis use. Um, so we're going to talk a little bit in a while about where the evidence is on benefits as well. Let me ask you if you know, oh, my computer is like moving forward automatically, which I don't want it to do. Sorry. Do you know anyone who has cannabis use disorder or uses cannabis every day? Uh, I can't see everyone at once but I see a lot more hands going up. So far, not a lot more, 11, 12. Of the kids in your programs, how many of them would you say, how many of you have at least one who uses cannabis every day that you're aware of? I see some hands being raised as well. Okay. Do you know, how many of you know people who have had serious adverse effects from cannabis oh gosh, why is my computer going ahead automatically? Sorry. Have had adverse effects from cannabis, for example, had to go to the emergency room. Huh. Um, okay, so quite a few people know someone who's had to go to the emergency room. So that, raises the question of why should we care and doesn't cannabis have beneficial effects? So let's talk a little bit about that. Um, the first question is really, does cannabis have beneficial medical effects? And the fact is, it does have some beneficial medical effects. The cannabis industry likes to talk about it as a natural wellness product, which is something I would really question. but it does have evidence of being effective in certain areas. One of them that's really important is treating nausea and vomiting from chemotherapy. So people who have cancer find it beneficial for nausea and vomiting. People who have multiple sclerosis, it helps them with their spasticity and pain. Some forms of chronic pain, it can be helpful, but not all. The studies are mixed. But it's generally not recommended by pain experts because there are typically other pain medications that can be as or more effective with less risk of dependency. It also can be helpful for some very rare and serious forms of seizure disorders, epilepsy. Um, in fact, there's a couple of very serious forms of seizure disorders in young children, Lennox-Gastaut and Dravet, that are terrible, and cannabinoids are found to be helpful. But if you go to, but in general, first of all, those beneficial effects have generally been found with cannabis that looks more like the traditional plant. So the traditional plant was about 3 to 5% THC. Like when I was in college, that's what it was. Now what they sell in the stores is about 20 to 30% THC. It's almost 10 times stronger. But the beneficial effects from medical research have generally been with low potency THC and smaller doses. Too small typically gave no benefit, for example, in some pain studies. 4% was providing significant pain decrease, but 8% actually increased pain in some studies. And almost all of the cannabis that's being sold in dispensaries in California today is well above 10%. In fact, it's hard to find anything below 20% in dispensaries today. So a lot of pretty much all of the evidence around medical benefits is in a very low potency cannabis range that actually doesn't look a whole lot like what's on most of our market, although some medical dispensaries carry preparations that are better dosed for medical patients. But there are a lot of claimed medical effects that have either been found not to be true or just haven't been proven. Um, and that's a lot of the materials and stuff that you'll see in a cannabis dispensary if you go to a cannabis dispensary or look at ads. So cannabis does not help fight cancer to our knowledge. In people with psychosis, many of whom use cannabis to try and reduce the anguish from their symptoms, using it has actually been found to cause more psychosis, relapse, and hospitalizations, and worse treatment outcomes. There's some effort to study CBD to see if it's helpful, but in reality, cannabis use for people who have psychosis or schizophrenia, the evidence is pretty strong that it's making it worse. Similarly, it doesn't fix depression. It may make it worse. Again, CBD may have some promise, but it's not clear. Um, so one of the most common things we see, and I'm guessing you're probably seeing this with the kids you're working with, is that a young person will have anxiety, stress, depression, and they'll be taking weed to treat that, those feelings of depression or anxiety. And while they may get some short-term relief, over time, it tends to make it worse. Cannabis doesn't fix glaucoma, which is one of the things it's allowed for in many states. A lot of veterans have used it for post-traumatic stress disorder. I don't know if any of you have experience with that. The evidence is very mixed on that. So some people swear by it and say it's been really helpful for them, but the larger studies have had mixed findings. And most importantly, most people who are using cannabis medically don't really get any medical guidance. They get a card from some doctor who's selling them for 50 bucks. But they're, with a few exceptions, there are some serious medical practitioners who are working with this more conscientiously and actually trying to understand what works and what doesn't. But most people are getting a medical card, their doctors are not telling them what to take or how much to take or how often to take it. And they're going in and getting advice from a bud tender that has very little relationship to what's been studied about safe use of cannabis for medical reasons. Um, and that is a problem. So how did legalization affect our kids? Um, this is the first really good, and I think this is the really important and positive thing that came out of first decriminalization and then legalization, which was we were putting immense numbers of young people, especially men, in jail because they had a joint in their pocket, because they had a small amount of weed. So the war on drugs disrupted, huge numbers of lives with prolonged incarceration and criminal records that affected people throughout their lives. And the movement to decriminalize cannabis and cannabis possession has really had a major impact on this. This is number of arrests in different age groups in California, and we have seen a 98% decline in marijuana possession arrests between 2009 and 2020. Um, we also, in the state, Prop 64, when it passed, had a provision that allowed to expunge past criminal records of possession arrests. Um, at first, that wasn't being implemented very well when it was a passive thing where people had to go to the courts and get their record expunged. Almost nobody could afford to do that or was even aware of the possibility. So shortly after passage of legalization, other bills passed that made it an automatic process where every county was obliged to automatically expunge criminal records from people who had been arrested and convicted for marijuana possession. So California moved forward on that slower than we wanted, but eventually, the last report from the Department of Justice, 93% of those who had convictions had been expunged. Sometimes, if there were mitigating circumstances or things, they didn't get expunged. That I think is probably the most important benefit, these criminal justice changes from the legalization and decriminalization process, not putting people in jail for cannabis. But you didn't necessarily need to have a large for-profit sales system to do that. That was really about decriminalizing and making it no longer a crime to be in possession of cannabis. Um, our kids are really, and young adults through age 26 are actually particularly vulnerable to harms from cannabis and to all the adverse effects. Um, the and the reason for this is that your brains, even though you might look like an adult, your brain is actually still developing until you're about age 26, thereabouts. So that period of brain development makes you more likely both to develop dependency and to develop adverse effects from the psychoactive components of cannabis. And overall, why cannabis use in teens has actually declined at the national level. What has increased is the frequency of use by teens rose by about 26% after adult use retail sales began. So we haven't seen so much a general increase in use as we've seen an increase in the number of young people who are using in problematic ways, like using every day, which generally typically is a sign of dependency, although not always. So this is from our research with the California Healthy Kids surveys, and it's the different lines were different types of jurisdictions. The straight line is 2018 when recreational sales began in the state of California. So before recreational sales began, cannabis use rates in teenagers, this is how many teenagers used in the past 30 days, based on a survey that they administer in high schools all across the state, and use was going down. After legalization, this is actually frequent use, kids who use every day. So the number of kids who were using every day was going down. And after legalization, it started going up and has continued to go up. Um, and and the policy profiles are what those jurisdictions were doing, because in California, not every city or county has to legalize cannabis sales. About 60% of them have, and about 40% of them have not yet. And the places that were sort of most liberal about cannabis sales, even allowing medical before legalization, had the highest rates of consumption. And the places that were most restrictive generally had the lowest rates of consumption. But interestingly, that was the case even before the law passed. So there may also just be something different about those communities. Um, between the ones that legalized and the ones that didn't legalize.
Mhm. Hey,
Uh,
Lynn, I see that we may have a question. Would it be okay to take
yeah, sure.
questions?
Mhm.
Juan Carlos?
Yeah, thank you. About the county litigation, this question came up in a meeting that I had in my in the county that I'm working in. The county that I'm working in currently does not allow, but the neighboring counties do, and the
Mhm.
counties are delivering still in the county that we live in. Is that legal or like how does that work? Because that question had came up yesterday.
So a county can prohibit delivery of adult use recreational cannabis. Until last year, they could also prohibit delivery of medical cannabis. But a bill was passed by Senator Weiner a couple of years ago that obliges local governments to allow at least one medical delivery company to operate, but the county does not have to allow um, recreational use delivery, and they can enforce against that. We did just publish a study like last week where we looked around the state, and what we are seeing is that the even though a lot of jurisdictions have a no delivery rule, they're not being enforced, and people were just as likely to receive cannabis by delivery in a prohibited jurisdiction as in a non-prohibited jurisdiction. So if your county wants to keep its delivery law, they need to enforce it. Um, and they need to, one way to do that is to require, well, that would essentially be legalizing. Like you can, if you're legalizing, you can require people to get a county license, even if they're delivering from outside. But if you're not legalizing, then you just need to enforce it. You need to do like mock purchases and show that they're violating the law, for example, and fine them. Um, but yes, they can enforce against delivery from outside, but they have to allow some form of medical delivery. Does that answer your question, one?
Yeah, again, that is like the majority of what they're dealing with is our county doesn't allow medical sales. There's not a dispensary within our county, but our neighboring county does, and they go and instance happened where a student had used his either parents or someone's elder ID, scanned it in on the app, put in their information, used the app that they use, and got it delivered, and then they got caught at school, and that's how they got figured out that you, even though they're not in the county, neighboring counties could still deliver into your county. And like you said, it would be up to us to then bring this predicament up to them, like at their facility and say, hey, you're doing this and in our county, we don't allow it. And again, it would, I guess it would take the police department to, you know, figure out some type of way to enforce and be obviously lawful about it, not like discriminate.
Yeah, you'd have to work with your county code enforcement. And like this is the kind of thing that's great to demonstrate and show them data. Show like 5 kids we ordered from this place and they delivered to all of us. They didn't check our IDs. Um, for example, or if you have other examples, they legally are obliged to check IDs on delivery. So they're not supposed to hand it over to a kid. And even then, the person would have to have a valid medical card. 18 to 21-year-olds can have valid medical cards, and a lot of them get them so that they can get deliveries of cannabis. Below 18, they can't receive unless it's a parent purchasing for medical use only. If you have more questions about that, happy to help out. Any use is a little bit different. So that last slide was frequent use, people who are using every day. Um, any use was stable to declining very slightly before legalization. It bumped a little bit right after legalization, and then it started declining a little bit. We have another study. This was with the California Healthy Kids Survey. We have another study we're doing with Kaiser where actually looks like it rose until the pandemic and then fell with COVID. But we're not seeing radical increases in any use. What we're really seeing is increases in problematic use patterns in young people most significantly. Um, and then where we're seeing real problems is young adults. So young adults 19 to 30, um, we've seen a quadrupling of the number of young adults who use weed every day. And that's really worrisome. That's that blue line down here. So in 1991, it was 2.4% of young adults reported using weed every day. And by 2023, that had risen to 10% of young adults. We're seeing a similar pattern in older adults, 35 to 50, but not as bad as in the young adults. But what that means is 1 in 10 young adults is getting stoned every day, and that's a lot. That's probably not good for their, mental health, for their work life, for their personal life, and affects them in many ways. Part of that is that there's really a decline in the perception of harm after legalization. I'm going to read you some comments from clinicians who take care of kids, so you can hear what they're saying. And they describe it as lab like. Well, how do you know it's safe? Well, I get it from the cannabis store, or somebody gets it and they pay them, so they're like, it's safe because it's coming from the store. So the legalization really changed people's perceptions. Um, and clinicians are also seeing increasing daily use. So another clinician in the survey we did said, I do think we've seen an increase in the number of kids that are just smoking pretty much all day long. And then he's talking about before legalization, we didn't have as many of these kids in the past that really truly have become addicted to marijuana. What are the adverse effects of cannabis on health? There really are quite a few. And like tobacco, cannabis has been associated with adverse effects on many conditions in many parts of your body, um, which is not good. You may be aware of some, you may not be aware of others. The first one is cannabis is addictive. So no, it's not fentanyl. You don't drop dead from having some minuscule amount like you might with a fentanyl overdose. But because cannabis is so widely used and such a large part of our population uses it, there's a significant subset of those people who are getting into trouble with that, and the numbers are very large. Um, Risks for developing dependency are, first of all, most importantly, the age that people start at. So people who start before age 16 are much more likely to develop dependency, with over 40%. In general, at any age, it's about 1 in 5 to 1 in 4 of the people who use become um, who develop some form of dependency. And this is really different. It used to be half this amount of transition to dependency. And the reason for that is probably these really dramatic transformations from the traditional plant to industrial strength concentrates, vapes, wax, shatter, rosin, live rosin, butter, all the different products that are out there that are just very different from the botanical plant. Today, far more people use cannabis every day than use alcohol, which is like a major flip in what people are using. Um, and a lot of this is due to dependency driven by increased potency. And people who start like in middle school or early high school are most likely to develop these issues. So, what is cannabis use disorder? What does it mean? It's not like opioid withdrawal where you have these horrendous, violent, very severe symptoms. It's more subtle, but it is very real. Um, it basically is defined by a series of criteria, but if it's interfering with your school, your personal, or your work life, if it's causing you distress, if you're having cravings when you stop using, um, if it's impairing things you need to be able to do, if it's using up your financial resources, you're having withdrawal symptoms, if you're using it to the point where you're doing hazardous or stupid things, these are all symptoms of cannabis use disorder. Um, and many people are not aware that their withdrawal symptoms may be due to cannabis withdrawal, and they take cannabis to treat the distress that may actually be their withdrawal symptoms. Is a pretty common situation. Using cannabis daily before age 17 can have long-term bad effects on people. Most notably, using daily really reduces rates of high school graduation and college graduation in particular. Just daily use can be a major source of interference with success in basic life goals. This is actually a study from 17th of 2,500 kids in New Zealand that were followed for 30 years. Mental health is another major area where we're seeing pretty dramatic effects of cannabis use. So cannabis use, people say, oh, reefer madness. No, that's war on drugs discourse. What was false and untrue about the war on drugs discourse was anyone who smoked a joint is going to develop reefer madness. That's obviously baloney. Most people can smoke a joint at a party or something and they're not going to become psychotic. But unfortunately, a subset of people who use weed are sensitive to it and do develop psychosis and sometimes out and out long-term schizophrenia. Um, Psychosis and schizophrenia are already diseases that typically start in late adolescence or early adulthood. Psychosis means when you are hearing or seeing things that aren't real. So people have delusions that something is happening. They may have paranoia. They may be hearing voices or seeing images that aren't real. Psychosis increases about threefold in people who are using cannabis every day. And people who are using cannabis that's more than 10% THC, which is pretty much the entire California market, psychosis risk increases about fivefold. And I don't know if any of you have family members with schizophrenia. My first love in life was a young man who developed schizophrenia, and there's almost nothing more painful. It's really hard. It's very hard on families. It's very hard on a person. It has major impacts on quality of life. Fortunately, it's somewhat treatable now, but even with treatment, it changes people's lives quite dramatically. Um, so the idea that we're allowing cannabis products to evolve in ways that increase the risk of triggering psychosis, for me, is very disturbing and very worrisome. So cannabis-induced psychosis, it can be everything from a transient psychosis. Okay, I'm stoned, and then my being stoned evolves into being paranoid and thinking somebody's chasing me or wanting to kill me, and a transient delusion or hallucination or paranoia, to actually triggering permanent difficulty with psychosis. It seems to be interacting with people's genetics. So people who have a family history of psychosis or schizophrenia are more at risk. But most people don't know if they have a genetic predisposition, and most people who have the genes that can make you more likely to develop this don't actually develop it. So it's a risk. Having the genetic predisposition is a risk factor, but it's not like everyone who has it would go on to develop schizophrenia, only some. And cannabis may be the trigger that makes it happen or makes it happen earlier in life for these individuals. But a lot of people, most people just simply don't know that they have that kind of risk. So this is a comment from a clinician, and he says, or she, I don't actually know. Well, I would say that prior to 2018, we saw a number of kids who would smoke weed and get psychotic, but they were predisposed. I would actually say it's probably, oh, sorry, about twice as common post legalization. I think the higher dosage on these brains that are predisposed and more vulnerable, I don't know how to say this exactly, but kids who smoked a joint daily or a couple of times daily, they could lose motivation and look depressed and all these kinds of things. But kids who vape or use cartridges or edibles daily, they get psychotic. I'd say I have 3 or 4 kids and just kind of describing what they're seeing in their practice with these very high potency products that are now available. So the data on other kinds of mental health issues, depression, bipolar disorder, and anxiety, is less extensive than for psychosis, but a growing number of studies are confirming that these risks are real. The symptoms can be acute, like smoking a high potency cannabis product and getting very also large studies from the NIH with suicidal ideation and increased suicide attempts. So again, we often see teenagers treating their depression, their angst with weed, but it may in fact, especially regular use, increase their suicide risk. And that's something that people who are mentoring or working with teams want to be aware of. Suicide um, in one large national study. So this is, again, a comment from a clinician. It's a whole different world now, the way this played out. I mean, 5 years now since legalization, he's saying, and it's going to get worse. Anxiety's up, depression, ADHD, bipolar's up 5 to 8 times a week. I say the same line because they have this mental health issue. They go smoke weed, and weed helps in the beginning. There's no doubt about it. They smoke cannabis weed in the beginning, but 2 months, 6 months, 8 months later, the mental health issue comes back doubly as hard. So young, like before 15 or 16, is associated with worse cognitive performance and actual changes in brain structure and function in recreational users. Um, Starting young is associated with more psychosis and depression. And overall, the mental health effects seem to vary over the lifespan, with being most severe in young people. And they also depend on product type and use patterns. We're still learning about them, and we have a lot left to learn. But I think the main lesson is cannabis is not a safe wellness product to be used for addressing mental health problems in young people. If anything, it's exacerbating them. Another big area of adverse effects is in pregnancy, and especially in pregnancy for young people, where they're more likely to use cannabis than in older mothers. Um, we've studied hundreds of thousands of pregnancies in California, working with Kaiser, and basically using cannabis during pregnancy increases risk of low birth weight, small babies, prematurity, NICU admission, the woman having, so those first four are for the baby. They also increase risk of high blood pressure in pregnancy, and what's called preeclampsia, which is a very serious pregnancy complication. And yet, a lot of women are also have this low perception of risk. They think it's legal, it must be safe. This is a safe, natural product I can use to treat my nausea of pregnancy with. They go into a store and a bud tender tells them it's okay, which happens a lot. But the evidence is really showing that, like tobacco, using weed during pregnancy is quite harmful. But since legalization, prenatal use has more than doubled in the United States. So despite the evidence that it's harmful to the baby and the mother, because of this intensive marketing as a wellness product, um, use is going way up. And in our data in California, unfortunately, we saw that way higher in Black women. I think, potentially as part of the kind of liberatory reaction to pulling back on the war on drugs and all the harms that had caused in the Black community. People have a perception that it's legal and okay now. That's not accurate for pregnancy. We're also seeing evidence that the babies who are exposed in pregnancy may have long-lasting negative effects to their mental health and neurological development. This is a big national NIH study of children who were followed through who actually started being followed at age 10. And they looked back to see who had been exposed prenatally to all kinds of different environmental factors, and cannabis was one of them. And cannabis exposure was associated with a number of different types of behavioral issues in children at age 10 after pregnancy exposure, although not all the studies agree. So some of the studies have different findings. Another one is heart disease. I don't know about you. I was 9 when my father died from a heart attack at age 45. I like psychosis. I don't like hearing about preventable heart disease or heart disease that shouldn't have happened in the first place. But heart disease is the leading cause of death in the United States and in most of the world. And the data on cannabis is showing a doubling of heart disease risk. Cardiovascular disease is sort of the combination of heart attacks, strokes, other forms of diseases of the blood vessels. Risk for heart attacks went up by about between a quarter and a third. It went up a fifth for stroke. And we're seeing unexpected cardiovascular events like heart attacks in some younger adults who use. Um, so even small changes in cardiovascular disease, because it's the leading cause of death, can be pretty significant. The other area that we're seeing and people have long been aware with is car crashes. So increasingly, a lot of young people, and you may be seeing this with the young people you work with, think that it's okay to drive. Why, hi. It's not. It really does interfere with your ability to drive. There is substantial evidence that motor vehicle crashes increase when you're using weed. And if you co-use with alcohol, the likelihood goes way up. Um, you can still be impaired when you're not feeling high anymore. And you can be impaired when you're using for medical reasons too. Unfortunately, law enforcement doesn't have great tools. So, like, we have buffometers and good tools for measuring alcohol levels, and they correlate well with impairment. But for cannabis, blood levels and these measures really don't correlate well with impairment. So, they're mostly doing field assessments of sobriety, which can be problematic. And then also, we see sometimes just kids have a psychotic reaction or they have a paranoid reaction. They jump in the car, they're driving when they shouldn't be driving, and bad things happen. Um, is a common scenario as well. How many of you have heard of cannabis hyperemesis syndrome? Do you know anyone who's been barfing their selves like crazy from cannabis? This is one of the more unusual things that we're seeing in ERs across the country now. But it is severe cyclical vomiting associated with heavy cannabis use, basically daily. It hits men more and those who start before age 16, often confused with other gastrointestinal illnesses. So we have a lot of young people who are getting like expensive, complicated GI workups for symptoms of nausea. Um, when it's actually cannabis, it's a frequent cause of ER visits. It's estimated now to be affecting almost 3 million people in the US. And the ER visits for this have doubled in the last recently. And the strange fact, and almost the way you diagnose it in the ER, is that it is alleviated by hot showers. So we have people who have insane levels of nausea and vomiting. They take hot showers, it goes away. Um, and then it comes back afterwards. Like a friend of mine who's an emergency room nurse, the first thing she asks when someone comes in now with severe nausea and vomiting is it relieved by hot showers? And if it is, they know it's cannabis hyperemesis syndrome. There's a lot more issues that have emerged in terms of health effects. If you have lung disease like chronic obstructive pulmonary disease or bad bronchitis, smoking makes it worse. Unlike tobacco, we haven't seen increases in lung cancer risk, but there is some evidence of increased testicular cancer risk. Um, there's evidence of actual physical changes in the brain in people who start using young. There's studies of IQ in people who start using young. Some of the studies have found decreased IQ, but some of them haven't. So that's kind of a mixed bag on the research. And there's an increasing number of studies that have shown fertility changes both in men and women. But some of these areas are less well established. So overall, I think I might have shown this last time. This is kind of a conceptual diagram, but we have what's going on in the community. What is our public policy saying about cannabis? Is it allowed or not allowed? And that creates a market with a determined set of characteristics and products that can be sold and marketing and advertising that's happening that guides people's beliefs um, and what the community thinks about cannabis. That leads to a set of exposures to these products where the potency of the product and how frequently you use it make a big difference. And then the characteristics of the person who's using it also make a huge difference for how that affects their lives. Some of those are biological characteristics, how old you are, whether you're a man or a woman, your genetics and your predisposition to mental illness, whether you're pregnancy or not, and so forth. And some of those are social characteristics, what trauma you've suffered, your education, your access to healthcare, effects of racism, and so forth. And all of those act together to determine who it is who's going to have a bad outcome and who's going to be just fine smoking a joint at a party. And
Mhm.
it's really complicated. Uh, we can't predict reliably who's going to be the person who's going to develop an adverse effect or not.
Mhm.
Um,
Yeah. Hi, Lynn. Quick question, kind of along those same lines that came up in the chat. There was actually two questions that came in the chat, and one of them, it sounds like maybe you've touched on, is why do some people get paranoid with cannabis use?
we don't understand it for sure. Potency is definitely a factor. So part of it depends on what product are you using. The stronger the product, the more likely that is to happen. So, general advice to people is start low and go slow, not just for edibles, but, you know, with if you're using weed, go with lower potency products, ask bud tenders for lower potency products. If you can find it, flower, 10 or 15%, which is hard to find in California. If you're having edibles, start with 5 milligrams, not 10. Um, and avoid concentrates like vapes and shatter. Dabbing is probably the worst
Mhm.
in terms of risk because that gives the highest of all doses. But then, in addition to what are you taking, it's really the person's probably their genetics and their internal predisposition to psychosis and psychotic episodes um, that may be deciding that. But like you don't know if you're one of those people or not until you
Mhm.
Um, and that psychosis may be just, transient for a few hours. It may be bad enough to land you in an ER, or it could be the trigger of a psychotic break that's more significant and long term. And those are the really heartbreaking cases where, we see kids who are doing fine develop psychosis and it becomes a permanent psychotic break. The good news is a lot of kids who develop even significant psychosis with cannabis if they stop using, the psychosis gets better, unlike schizophrenia, which doesn't typically go away. So sometimes it doesn't, but I've heard a lot of stories from families now and clinicians that really consistently stopping cannabis use stops the psychosis. Starting again, it comes back.
Mm-hmm. Oh, another question came into the chat. Someone asked if the effects are reversible. And from what you shared, it sounds like it may or may not be. It just depends, or
Um, yeah, it depends. And I think we're still learning a lot about this because, because cannabis was illegal for so long, it was very hard to do research. But psychosis appears to be a mix of reversible and irreversible, depending on the people. Treatable, even when it goes into long-term schizophrenia, it can still be treated most of the time, but it may be a lifelong problem in some people.
okay.
And we're also seeing bipolar disorder developing at a higher rate in cannabis users.
Okay, thank you. And then there's one final question before we continue. It says, are youth just as susceptible to these adverse effects when exposed to excessive secondhand smoke at early ages?
Um, well, secondhand smoke um, definitely delivers some risk to people. For example, we're seeing cardiovascular effects with secondhand smoke. I saw lobbyists in the state legislature get up and swear that cannabis secondhand smoke was fine and perfectly safe to our state legislators. That is a blow to crap. That's not true. So it's very similar to tobacco smoke in many ways, but the dose you get with secondhand smoke is nowhere near as high as the dose you get if you consume directly. So I don't recommend smoking around kids. It does increase their asthma risk. It may increase pulmonary risks. You don't usually get high with it. Um, but especially children, I think it's not good to expose children to secondhand smoke. It's not good to expose anyone to secondhand smoke. But increasingly, I think with legalization, we're seeing parents feeling like it's okay to smoke weed around their kids or even to smoke weed with their kids. And that's really not a good idea. Um, let me just touch briefly on some strategies and then wrap up and let's have some discussion. Um, really kind of the strategies for reducing adverse health effects fall into two groups. So the first group is change the environment. It's change the drivers, the policies, the systems, and the way cannabis is operating in your community. And the second group is around supporting the individual, youth, or family through treatment or for prevention, which is probably not what you're doing. Well, you're doing actually prevention, but not treatment through actual supports to the individual. So changing the drivers, some of that is bigger social policies that change the social determinants that drive people off into substance abuse, poverty, housing, education, violence, racism. We're probably not going to solve those here today, but much as I would like to. And then there's what I call the commercial, not I, but other researchers as well call the commercial determinants of health. So the characteristics of the cannabis market that drive cannabis use up. How many stores are there? How are they operating? How are they able to market products? What kind of product types are they selling? Are they ones that have celebrity pictures and cartoons and fruits, pretty pictures of cherries and mangoes on the front? How much do they cost? Smoke exposure to cannabis secondhand smoke, as someone mentioned. Accurate information. So these are things that are commercial determinants of adverse effects and that we can work on in policy systems and environmental change work. And that's sort of my specialty. And then there's supporting the individual, which is a lot of the work you're doing in EYC, providing mentorship, providing a supportive community environment, peer programs, alternative types of activities to substance abuse that youth engage in, building life skills and engagement, educating about substance use. I actually saw amazing data that I just sent to Shira yesterday, I think, from Iceland, which really built up as their approach to substance abuse, just making it really easy for young people to engage in other types of healthy, educational and creative outlets. And they had fabulous impacts on reducing substance use in that country. And then, of course, there's healthcare, which in our country is not that easy, but assuring that our young people have access to healthcare, that that kids are screened for cannabis use along with other substance abuse, and that we have available both brief interventions and referral for treatment where more complex treatment is needed or there's addiction. There's a huge backlog and shortage in the state of mental health professionals and resources for this. And these are barriers we still need to address. Um, so just some tools and resources. There's a lot of stuff on our website. These are some principles for cannabis policy, examples of what local communities have done around the state of California, model laws that we have. This is a toolkit for youth program engagement around cannabis policy in the community. This is a guide from SAMHSA. We're providing technical assistance to EYC programs, not on individual treatment, but on the policy and systems change aspects um, through monthly office hours and hands-on one-on-one coaching. The idea is office hours programs can be on together and exchange experiences and what you're learning, and in addition to getting TA, and the hands-on coaching is more one-on-one. So in summary, cannabis does have some legitimate medical uses. We're still learning what those are, but the use is widespread and it's mostly recreational, and harmful use is growing. Self-medication using cannabis for conditions for which it is not safe or effective is really common in young people. Adverse effects are pretty widespread and some can be very serious or even fatal, notably psychosis, accidents, and suicide. Cannabis is addictive, even though it isn't like opium. Um, Potency, how old you are when you start, and frequency of use really are big drivers of risk levels. And we need to change both the context and support the individuals to reduce harms from cannabis. So, what are you guys seeing? with your kids? Does this resonate? Does this sound totally crazy? Um, have you seen these things going on with your kids? Let's just have a free discussion. Does this sound untrue? Um,
I do see a couple of hands. Jessica?
Hi, Lynn. Thank you so much for this incredible presentation. It's very enlightening for me. I'm from a culture and a country where I think there's a skewed idea of how weed is used. So my experience of cannabis was a lot different growing up, as it was used in tea for health reasons and really only smoked for religious reasons and rarely used in a recreational way that I'm seeing now, especially in the US. Um, so the comment from the clinician that you referenced mentioned dosage. So I'm curious, are the adverse effects that you've explained associated to a specific dosage or potency versus like the plant grown in the backyard that I might be used to? And in these research studies, is there a baseline dosage or potency that they're considering?
so yeah, it's really complex. Basically, it's like poppies were used for millennia for pain, and then they became opium, and then heroin, and then codeine was synthesized, and then fentanyl was synthesized, and there was this continuum from a traditional medicinal botanical to industrialized high strength products that are just much more harmful and much more dangerous. And we saw it in opioids, and we're seeing it in cannabis now, although not quite to the extreme of fentanyl, thank God. Um, but dosage is everything. I would say that what you're growing in your backyard is probably a lot safer than what is sold in, even though it may not be perfectly safe from a agricultural standpoint. It's less likely to be a high potency concentrate. It's especially when we're taking solvents, extracting the THC and making products that are 70, 80, 90% THC, you really increase the risks of harm. But also, even flower that's in dispensaries now, as I mentioned before, is 10 times the traditional level of the plant.
Mm.
So to the extent that you can grow more traditional weed that's lower potency, you're less likely to have adverse effects. There have always been people who are sensitive to cannabis. So even 100 years ago, um, we knew of examples of people developing psychotic reactions to cannabis. So you won't eliminate it 100%, but the lower the dosage, if you're going to have an edible, start with 5 milligrams or less. If you're going to smoke weed, see if you can get weed that's less than 10% or less than 15%. As I mentioned, it's really hard to get that right now. Some clinicians even have their patients cut weed with other plant material to reduce the potency. I don't prescribe that way, but I don't prescribe weed at all. Um, the But basically, the lower you can go on potency and the more you can avoid high potency concentrates, the better. Discourage people from dabbing,
Yeah,
discourage people from vaping, actually, which is also very high potency, and
yeah.
use less, if you're going to use it. If you're going to
I
use it, I
think,
don't encourage anyone to use, but if you are going to use it occasionally and not every day.
yeah, what I'm seeing with the youth, is there's a intentional shift towards organic, towards natural, and people saying I'm choosing weed versus alcohol because it's cleaner or whatever. And I'm wondering if it's maybe a marketing thing that needs to be addressed as far as how we're positioning weed, especially if it's not healthy in the way that organic tomatoes are, right? So yeah, I'm just the reason for usage is that, oh, it's a natural alternative to Tylenol. Um, And I wish there was a better way to communicate these adverse health effects in a simplified way for them to understand that this is not a part of the organic food movement. If that makes
Yeah,
sense.
you nailed it. Those strategies in marketing are called whitewashing and green labeling. Basically things like saying organic, saying environmentally this or and so forth. Take a product which is an addictive product, you know, even if it's enjoyable to many people, and make it sound like a healthy organic food or something. And it's not. It's been those practices have been prohibited for tobacco for many years, but they are being used by the cannabis industry and have not yet been clearly prohibited. But they should be because they
Mhm.
create the illusion of safety, even if it's true that it's an organic product and there is less risk from pesticides, which is good. By marketing it as organic, you create a false illusion of safety.
Mhm. Thank you. I see that Juan has their hand raised, and there's a couple questions in the chat if we have time.
I have,
Yeah, I just wanted to kind of share with the youth involved in some of the schools and the schools are really tackling this things like, you know, their time is getting spent like trying to catch these individuals and money is getting spent on sensors and all these things and, you know, conversations with them. All this takes a lot of time from actually what, you know, school a school environment should be providing. Um, but outside of that, I feel like from the conversations and what the kids have opened up with their peer teacher or their staff member about like, you know, what's going on at home and like she said, you know, well, I'd rather you do that than, you know, drink and you're gonna crash your car or, you know, my parents gave me it because they don't want me taking actual medication for my ADHD and that's something that's kind of, you know, cycling as well. ADHD it helps me focus and these things and like you said, I feel like the psychosis part of it hasn't really been explored just because from what you know, just looking and talking amongst the community and us as adults, because some kids have been taken out in stretchers because they're hallucinating, like, you know, can't handle what they you know either consumed or someone cooked the batch and not knowing what they were doing and you know didn't know that the potency out of what they were doing should have been more. But it seems like there's an underline of either emotional issues or pain or stress or odd emotions that the teens do have that, like you said, at ages 25, I would hope that, you know, you already had, you know, navigated yourself through these, answered some questions that are, you know, odd in your life, that's where it seems that these psychosis kind of issues happen because some students that have a background that they know they had, you know, issues prior to even this, you know, uh, marijuana use that now when they have it, you know, we're seeing that, well, they are already had aggression issues and they already had these things. And now that they consume weed and they, you know, are saying all these hallucinant kind of things, it seems like they didn't work their problems out. And now it's a mind game that they're talking to themselves, you know, like they're kind of opening a door that they themselves couldn't already open that when they get in, you know, smoking very high levels, it's an instant open that door. As you're saying, it's not like a smooth introduction to, you know, alcohol has kombucha has some alcohol, you know, then you're having your spirits and you have your beer and you have your hard liquor. Like, you know, there's stages of that as well that people when you're the age, you know, oh well, prefer this or that. And that's also been a thing where like it's illegal. You know, I'm in the age, I'm in that right. Like you're not letting me do it now, well, I'm gonna do it later. There's so much going on with, you know, advertising. It's illegal in age group ADHD and medication, and then self-diagnosing themselves, like you said, and a dispensary employee saying like, no, this is what we think it's best for you because the industry that I know, and I don't know, I feel like there's so much information out there that even as a youth, when you're looking up on your phone, you know, you could come across information that sounds great, and this is what I could do it, and that's what you tell and you regurgitate that to your parents, and it just seems very hard to navigate it when
Mm-hmm.
they have this all the same information. So
Yeah, thank you, Juan. Juan, we're actually at time for the webinar, but I want to thank you for your comment. And I do want to share that it does reflect some of the comments that we're seeing in the chat as well. And then I'll see Dr. Lynn Silver, if you want to provide any response or any observations from what you shared in the chat, then we can go ahead and move to close out. But I do want to thank you all for your participation. And next time, we're going to allow more time for this topic for webinar lesson learned. So thank you, Juan, and thank you to those who have shared.
Thank you all. I see you're all living these issues with the kids you're working with, and I think all of you, it will be great for you guys to share amongst yourselves how you're learning how to address these issues and and what works or what doesn't work to fight these misconceptions and the false marketing that's out there, because this is really hard. We've been outgunned by the industry. Is some mandatory information that just became available in the dispensaries that they're supposed to be giving to people. Go to your local dispensary and ask for it and see if you can get it, just to know if they're even complying. But it's a complex issue, and we're going to have to, it took us a long time to get tobacco use down in the US. And I think right now we're on the upswing, and we're going to have to figure out how to get on the downswing and what messages work and how we combat much of this false messaging and the impact it's having on our young people. But you guys are agents of change. You guys are on the front lines with young people. Just being there for them, mentoring and giving them other alternatives for what to do with their time and their lives is really important, but also being able to answer questions and give them accurate information and emotional support and guidance is also critical. So thank you for everything you're doing. And we are here to answer questions. My email's there if you have questions on these issues. Jason Sarush is the other person on the team who you might meet.
Yeah. Thank you so much. And so again, I'll encourage you all to sign up for a coaching session. They're starting as group opportunities for coaching, and then we'll also have some one-on-one opportunities as well. So the conversation definitely does not have to stop here. And thank you again for joining today's webinar, and we'll see you on the next one.